thank them for their service and for being here. We have Terry Barnhart, Michael Cavanis, Mike Harris, Michael Norton, and Hal Rowe back in the back. We also have some pages here today that I would like to recognize and welcome. So happy that you're here with us. We have Senator Lewis from Charlotte, sponsored by Senator Daniel. Good morning. We have Paisley Rigsby from Rougemont, sponsored by Senator Meyer. Paisley, are you here? Do you know any of the pools in Rougemont? Yeah, my dad spent a lot of time on Luzon in a foxhole with one of them. He loved him to the day he died. Rufus Pool. Allison Medrano from Durham, sponsored by Senator Murdoch. Evan Warner from Mooresville, sponsored by Senator Sawyer. Welcome to you all. We're so happy to have you here today. We're going to jump into the agenda and move ahead. We'll start with Senate Bill 316, lower health care costs. Senators Bergen and Gailey. You both have the chair. You can fight over who talks.
She'll go first.
Thank you, Mr. Chairman. No fighting necessary. We got it all worked out. Senate Bill 316, lower health care costs. This is the Senate's next step in tackling unacceptably high health care costs. This is a comprehensive bill. It takes a few minutes to explain, shedding a light across the system to address costs from all angles and ensuring that we create actual change in patients' lives and in their wallets. Part 1 is greater transparency in healthcare costs. This section greatly enhances the current disclosure requirements for facility pricing for the most common healthcare services by increasing the reporting period to a quarterly basis from annual. Part 2 is greater transparency in healthcare provider billing practices. This is the surprise billing portion of the bill. This is the bill that was championed last session by Senator Kovic, and it passed the Senate unanimously as Senate Bill 321. Part 3 is greater fairness in billing and collections practices. It requires an itemized list of all charges to any patient before referring an unpaid bill to a collection agency. Also, the section establishes that a patient can request a good faith estimate, any expected charges, and if requested, then a patient's bill should not exceed 5% of that good faith estimate. So now I'll turn it over to Senator Bergen.
Senator Bergen.
Mr. Chairman. Thank you, Mr. Chairman, committee. Appreciate all of you being here today. Section 4 is greater protection for healthcare consumers from facility fees. This bill prohibits a provider from collecting a facility fee unless the services are provided on a hospital's main campus, at a remote location of a hospital, or at a facility that includes an emergency department. Section 5, State Auditor Review of Health Service Facility Fees. This section provides authority to the state auditor to examine facility prices charged to out-of-network and uninsured patients. Section 6, enhancements to employee safety. This language simply removes the requirement of a specific employee's contact information to be included on any appeal or grievance. And then Section 8 is eliminate CON on inpatient rehabilitation services, facilities, and beds. This section provides for more inpatient rehabilitation specialty services for services such as strokes, spinal cord injuries, traumatic brain injuries that are in state. Last biennium, this legislature made similar changes for inpatient psychiatric beds. This is a narrow step to start expanding services for those folks. And Senator Sawyer will finish up the bill.
Thank you, Mr. Chairman. The final part of this is a rollover for Senate Bill 315 with respect to prior authorization reform. There are 4 parts to this. The first is it provides a definition for urgent health care services and requires the determinations with respect to those services are made within 24 hours as opposed to the statutory 3 days that exist now. It also addresses the issue of peer-to-peer review of prior authorization and utilization review. It makes a requirement that a doctor must deal with somebody in that particular field and not somebody of a different field. It also provides notice and transparency requirements for authorization and appeals and utilization review, and make sure that those are published and clear for the patient and the provider to understand. And finally, it addresses the use and utilization of artificial intelligence in prior authorization and utilization review with respect to insurers in North Carolina. And I would kindly submit this bill for your consideration. Ask for a favorable report.
Thank you so much. Members of the committee, do we have questions for the presenters? Is everyone awake? Okay, does anyone in the audience care to speak? Seeing none, we have a motion for a favorable report from Senator Heiss on Senate Bill 316, lower health care costs. All in favor will please say aye. And opposed? No. Motion carried. Okay, Senate Bill 117, GSC uniform. Senator Gailey, you gonna do that one too? Good morning, Miguel.
Thank you, Mr. Chairman. Yes. So this bill updates the Uniform Commercial Code, brings it into clarifies what happens with controllable electronic records. It's been enacted in 25 jurisdictions, including Virginia and Georgia. The business law section of the Bar Association supports the bill. No opposition has been expressed. It's been shopped around to all the relevant constituent stakeholders that would have an opinion about it. So it also changes the definition of chattel paper. There's a new definition of money in there that accommodates that electronic money is a thing, but it does not regulate electronic money. It just accommodates what happens in transactions that are governed by the Uniform Commercial Code to say what happens if people decide to use electronic money. And then otherwise it has conforming changes. If anybody has detailed questions, we have staff here from the General Statutes Commission who are equipped to answer them. Thank you, Mr. Chairman.
Thank you. Members of the committee, do we have questions or comments? And we do have public comment, is that correct? Or we do not? We do not. Okay. We have a motion for a favorable report from Senator Sawley on Senate Bill 117, GSC Uniform Commercial Code. Emerging technologies, all in favor will please say aye. And opposed, no. Motion carries. Thank you. Senate Bill 311, Utility Worker Protection Act. Senator Britt, Senator Blue, Senator. Thank you, Senator Britt. I'm looking forward to hearing from you this morning. Welcome. You have the floor.
Thank you, Mr. Chairman, members. Simple bill, ran through judiciary, no opposition, came to us from the co-ops as well as other utility groups. Simply increases the penalty for an assault against someone working for any one of these groups from a Class 2 to a Class 1 misdemeanor. Senator Lowe.
Thank you, Senator Lowe. The chair will recognize you. Good morning.
Thank you. There was something that came to my attention. Every time you present a bill, there's no opposition. I just wanted to make that.
Yeah, thank you, Senator Lowe. I appreciate that.